I'm Dr. Scott Abraham. I'm an orthopedic surgeon here in Kansas City, and I specialize in robotic knee replacement. A lot of patients ask if they're a candidate for a robotic assisted knee replacement, and the answer is, if you're a candidate for a knee replacement, then you're a candidate for a robotic assisted knee replacement. With robotic assisted knee replacement, we actually map out that patient's knee during surgery. It's an optical system, and we put reference pins in the thigh bone and the shin bone so that the computer knows where things are in space. Think of it as a three-dimensional mapping system of that patient's knee. So during the surgery, we get a three-dimensional picture of the knee so that we can place the components more accurately, more precisely, better fit for that particular patient. So one of the advantages of robotic knee replacement is that we are seeing better long-term outcomes. And I think the reason for that is that the knee replacement is better fit for that particular patient. If we can put the knee replacement in more precisely, better balanced, more accurately, then that patient is going to have a better long-term outcome with their knee replacement, hopefully longer longevity of that knee replacement, and maybe that would be the only knee replacement that patient would ever need. If you're interested in robotic knee replacement, feel free to contact our office and come in for an evaluation.